Ladies and gentlemen, welcome back to your destination of the latest medical trends Medcast. Today, we are so pleased to have Dr. Abdulrahman AlKanderi, who is a senior specialist in urology and genitourinary surgery. Benign prostate hyperplasia is a significant health concern for men, particularly as they age. Early detection and treatment are crucial for effective management. By understanding the risk factors and adopting a healthy lifestyle, men can take proactive steps in their prostate health. Regular consultations with healthcare professionals are essential for prevention and timely intervention. So that today we have Dr. Abdulrahman AlKanderi to discuss more about the PPH. Welcome, Dr. Abdulrahman.
Thank you so much. Thank you for you and for the team. Hope the interview will be easygoing and informative.
Well, we had two episodes before, and was very informative and was very helpful actually for the audience. So hopefully this episode as well can be very informative for them. So, Dr. Abdulrahman, we need to discuss the benign prostate hyperplasia. Can you please explain more what is benign prostate hyperplasia?
So basically, I'll start with what's the prostate. Prostate is a gland, and
Mm-hmm.
it is only in the male, so
Mm-hmm.
it's not in the female, and it is around 20 to 25 grams, located just underneath the bladder. So we
Mm-hmm.
have the bladder, where is the urine accumulate, and then the urine will pass. We have the prostate just underneath it. So the urine flow will go through the prostate all the way to the urethra, to the pee hole.
So I remember in the medical references they call it a donut shape.
Correct.
Yeah.
Correct. It's a donut shape. So any enlargement of this donut shape will compress the urethra.
Yeah.
That will lead to difficulty in the voiding.
Mm-hmm.
And the main complaint that the patient usually will come, and usually they will be around 60s. So 60s is the peak age. They start usually from 50s, early 50s to 70s,
Mm-hmm.
but 60 is the peak age for the symptoms of benign prostatic hyperplasia. So they will complain of what we call the nocturia. They're waking up at night too much,
Yeah.
and it's bothering their sleep. And then the urine flow will become very weak, and it will be intermittent, will be not like a flow. No, it will flow and then stop and then flow again. And after they finish that, they feel that there is some residual urine. We call it incomplete emptying. And when they go out from the washroom, they want to come back within
After
50
time.
minutes.
Yeah.
So at least less than 2 hours, and this is unusual.
Mm.
Also, like if the symptoms develop too much, they will complain of urine leak, especially when they are get urged, they cannot reach the toilet.
Yeah.
When they are going to the toilet, they will have some drops,
Mm-hmm.
drops after peeing, straining, they need to push. And in the advanced stage, they will have what we call the urine retention, completely blockage of the urine. And then we have to put a catheter staff. So the enlargement of this gland will obstruct the urine basically.
It's gonna make many troubles for the men, as you said. It's
Correct.
only existing in the men. The question is that do you recommend the men is having regular checks when they reach to like a certain stage of age?
So your regular check is for prostate cancer, not only for the BBH.
Mm.
BBH, no need to have if you have a symptoms, you have to follow up for the benign enlargement.
Mm-hmm.
But for any male who's from 50 to 70, he should go regularly, once yearly at least, to check the prostate specific
Antigen,
antigen,
which is
which
the
is
PSA.
correct,
Yeah.
PSA. It's a blood test, very easygoing. You can go for any lab, they can check the PSA for you, because the prostate cancer, unfortunately, has no symptoms,
Mm-hmm.
and you don't want to discover it later. If you have a family history of prostate cancer,
That's the question. Yeah.
you have to go earlier. You have
Mm-hmm.
to go from 45 earlier. You have to be strict more to do the follow-up.
Okay. Apart from the family history and the age, as you mentioned in the beginning, is there any other risk factors to help the prostate to get enlarged?
So the enlargement of the prostate, we don't have a specific reason so far. We don't know what's the specific reason, but most of the theory and the strongest theory is it is hormonal changing.
Mm-hmm.
We have testosterone as a male, and testosterone is secreted from the testes going to our mm, brain, just lead us think as a male,
Mm-hmm.
going to the muscle, make it bigger, and going to the prostate, converting to what we call the
Testosterone.
dihydrotestosterone.
Yeah.
That will lead to enlargement of the prostate.
Mm-hmm.
So enlargement of the prostate is mandatory, and there is a huge study, autopsy study. Autopsy study mean that they check the cadavers, and they saw that it's multicentric, multiple countries. Any male who's more than 45 years, he will have definitely some sort of enlargement.
Mm.
It's different. So a lot of them, they have no symptoms, a small enlargement, but there is histological changing
Yeah.
in the prostate. So all the males, they have some sort of benign prostatic
The
hyperplasia.
same question goes for the hyperplasia as we have discussed before with the kidney stones. As a surgeon, as a urology surgeon, do you consider the surgical intervention as the first solution for the enlargement of the prostate, or will you have another plans for treating the hyperplasia? Then would you would decide to go to the surgery?
Great. So most of the patient will end with medication.
Mm-hmm.
And the surgery is also the same. We have symptoms and complication. So we start with medication most of the time and keep following up the patient. At least we need to see them 6 monthly.
Mm-hmm.
Why? Because we want to check if there is any complication happen. What are the complication that will lead me to stop medication and go immediately for the surgical therapy? If he has retention, blockage of the urine, if he has blood in the urine, especially if it is recurrent blood in the urine, I have to stop medication and go for surgical therapy. If he has a kidney damage, I'll say the patient, please stop the medication. I have to protect your kidney from damage, so I have to do surgery for you. If he develop bladder stones, that will be secondary to the stasis of the urine due to incomplete emptying of the urine. Otherwise, if he's not happy with medication, if he's bothered, or if he has side effects from the medication, so I cannot give him medication, he's bothered, he cannot sleep, I'll tell him, let's go for the surgical therapy, and inshallah, you will be happy with the outcome.
I think regarding the use of the medication, there is no such like diversity of very big range of medications. I think it's like just around
Two
three,
families.
yeah, two families, and they
Mm,
are like three or four medications
correct.
that might have different side effects profile,
Mhm.
but again, the effect might be the same. So that's why most of the patient might complain from using it. Now, after you have the decision to make the surgery, is there any different kinds of surgeries that goes for each patient, or it's just like one procedure that goes for every patient?
Correct. So this is the era now in urology, one of the area that a lot of investigation and development happened to it in the recent years. So we used to do what we call the TURP, that's electrosurgical resection.
Mm-hmm.
We go inside with a scope, so all scope, we don't open anymore. There
Mm-hmm.
is some surgeons still keep opening, but I mean,
It's
like
very rare.
it get limited in the few last years. So with the standard management or the standard surgical technique is the what we call the TURP, transurethral resection of the prostate. We
Mm-hmm.
use electricity. So we go inside, cutting the prostate, buzz the area of bleeding and stop it with coagulation effect, and then keep the catheter for 2 days. The patient will be happy.
Mm-hmm.
This is very nice technique. It has limitation, especially if the prostate size more than 80 cc or 80 grams.
Mm-hmm.
So if the prostate get enlarged and doing TURPs, that the patient will end of recurrence of the symptoms, that they will end with a lot of bleeding because the prostate is very rich with blood. So the new modalities, we do have what we call the HOLB or holmium laser inoculation of the prostate. And now we are using multiple type of energy to do inoculation. Basically, if we can imagine the prostate is an orange and the urethra in the middle. So when we go in the middle, we have multiple techniques. TURP, we go in the middle and try to resect this orange.
Mm-hmm.
The inoculation, no, we go from outside and we inoculate the prostate as we peeling the orange.
Mm-hmm.
So we take the whole obstructing thing. I'm talking about 70% of the prostate size will be out, and the symptoms will be significantly improved comparing with the TURP. Bleeding is less, recovery is faster, catheter for 1 night only. So this technique make a huge difference in the management of the patient, and it is size independent. I can do it for small prostate, and I can do it for even like I've done it for 350 gram, which is really huge.
Mm-hmm.
So this technique kill the open technique. The open technique is a very nice technique for a big prostate, but it is a lot of invasive.
Yeah.
10% we have risk of a blood transfusion. Big wound, the patient will suffer from the pain from the wound for 3 months. Infection rate is high. The catheter will stay for 2 weeks. Open technique is still valid. I cannot say it is dead, but it get limited recently. Uh, one more technique, we have now what we call the office-based procedure.
Mm-hmm.
Multiple techniques. One of them, we call it resume, which is we use a vapor of water, heating process. We go inside, 5 minutes procedure, inject a vapor of water to the prostate tissue that will kill the prostate tissue, and then the patient will take it out with the urination. And this killing, we go back to the same orange, we inject puff, for example, here and there, and then the killing of the cells will make the cavity wider a bit so the patient can pass urine. This is a very nice technique, and it is widely common used in Kuwait because it is a minimal invasive. All the urologists can do it.
And what is the chance of recurrence?
This is there is variation, but I'm talking about 10 to 15%.
Oh, okay. Now that takes me to another question, which is I think very important for most of the people or the patients having a hyperplasia. If they have the decision to go to undergo a surgery, any kind of the surgeries you have mentioned, will that affect like their libido or having some sort of dysfunction in the future?
Okay, so for the TURP, the classic way, there is studies showing that they might have some sort of erectile dysfunction, but libido no, it shouldn't be affected by the erectile dysfunction. With the laser, no, there is studies showing it is very safe and keep it the same. With the resume, which is the water vapor, as I said, keep it the same as well.
And
So it will not be affected.
well, and I'm sure if some sort of effectiveness that will happen to the erectile dysfunction, there is also medications or some sort of solution that can treat that problem.
Correct.
Dr. Abdulrahman, I'm very sad to say that we have reached to the end of our segment, and hopefully we can have you again to complete the discussion about the prostate hyperplasia, which is I think it's very common and also it's important to the most of the people or patients.
Thank you so much for
Thank you
you
so
and for the team. Thank you so
Thank you so
much. Take
much.
care. Bye.
Our dear viewers, we have reached to the end of our segments with Dr. Abdulrahman AlKanderi. Hopefully, we can see you again with another healthcare specialist. Until that time, goodbye.